So given what you said, I think it was probably important to set the scene a little bit today. And rather than have a discussion about this, these are perhaps three of the key thought areas that we're hoping to cover today, but hopefully we'll cover more. So we've talked a bit about all of the projects that you know about, and we've talked a bit about how you know that these projects are good. But when it comes to evaluation, we want to kind of think about what would a good evaluation of something look like and what would a bad evaluation look like. And also we want to kind of think about why we think evaluation might be needed. We've heard from you about some of the projects that you know are good, but the next stage is how might we evaluate some of those projects so we have a firmer sort of evidence base. And also, what does this mean when we think about health and wellbeing? And we've already heard the sort of breadth of your projects, that some of them are not necessarily stereotypical medical projects, but they actually take on the wider determinants of health, what we include in things like diet and climate and food banks, etc. So hopefully that's kind of setting the scene. So when we think about evaluation, hopefully this kind of builds on what you said. We think about some common reasons why we might want to evaluate something. Firstly, there's designing a grant application. So some of you may have had experience of this, of using evidence to try and support a grant application for a project that you feel is needed in your particular area or parish. And it's also about how do we know that this thing we're evaluating works, and who is it working for, how is it working, and when is it working, and also why is it working, are some of the things that we like to kind of think about when we evaluate. We also like to without being too negative, think about why things might not work and what learning we can get out of that particular process. So we don't see things as necessarily in abstract as success and failure, but draw on wider learning. So in that sense, you may be also delivering a project. So rather than being in the grant application, you might have had some involvement or have somebody who is delivering a project that you've commissioned. And are you meeting the requirements that the funder kind of stipulates in some of their specification? And also, some of you may have been involved in managing grant applicants and manage that process, and also distributing funding within your community. And how do we know that you're distributing funding to something that is, as we've discussed, really good and positive, but how do we know that in terms of demonstrating the evidence? And we do something that's also probably a little bit more academic in some senses, but we do it to advance knowledge. We evaluate and shine a light on issues and problems, but also the benefits and practice of these particular projects and how they add to a broader knowledge base. But one of my favourite reasons for evaluation is to improve real world settings, so that we're not looking at an ivory tower scenario, we're actually applying the evaluation to modify a service or improve the service for the people that use it, or extend the service to people who aren't currently using it. So I'll just move on to my next slide. So today we're going to think about those key thought points, and we're also going to think about some of the reasons for evaluation. And we're going to do this by hopefully introducing you to certain different types of evaluation and also who are involved in these processes. So we'll talk briefly about an outcomes evaluation, and then I'll talk briefly about a process evaluation approach. And Mark will then lead on looking at kind of impact evaluation and participatory approaches, i.e. who do we engage with. And hopefully the first part of this session, unfortunately, it'll be a little bit more abstract, whereas later on we'll see how we can apply these different approaches to a sort of a real world scenario. And that's something the scenario that we've chosen actually fits quite a lot with some of the projects that people have already shared with us today. So hopefully it will seem really relevant, and hopefully we'll move beyond that kind of first stage of just outlining evaluation approaches to actually thinking about what they look like when we want to put them into practice.
Hayden, I think, before we move on to that slide, can we move back to the...
Yeah, sure.
I think from listening to everyone's descriptions of projects and what they felt was good, and also what they felt they needed to add to it, all of these types of evaluation were touched on when people talked about their projects. So none of this is, I mean, although they've got fancy names, these types of evaluation, none of these evaluations are anything different from what people have said they would like or they're already doing there. So I think that's a good, you know, although it is a bit abstract, it's also seems to be quite applied at the moment. So
yeah, so we'll start on the principles, which will hopefully resonate, as Mark said, and then we'll look at kind of applying that to a scenario that we put across. So when we think of an outcomes evaluation, it's sometimes quite difficult to think about what outcomes really are. And the quote on the left sort of highlights the difference between outputs, because we sometimes hear of outputs, things that are quite easy to sort of count, really. So these are kind of the activities of services, whereas outcomes are those consequences. And Adam Crawford, this is taken from a guy who does a lot of work in community safety. He says that outcomes are those consequences that are intended or unintended, and how they kind of interact with the wider environment. Today we'll hopefully focus a little bit more on the intended outcomes. But some of the examples that we have are what the Treasury, there's this wonderfully dry document called the Magenta book, which is something that could take up a weekend if you so choose to read it. But it basically highlights that outcomes are short to medium term results. So these are the things that happen in the short to medium term. And Mark will talk a little bit later on about impact and the difference between impact and outcomes. But here are some examples, and we've chosen a variety of examples. So, for instance, one of the activities or outputs that people might be involved in is a change in diet, but actually the outcome is reduced bad cholesterol. So we would measure the cholesterol levels before and after to see if there's a positive change in reducing cholesterol, and that would be the outcome for that particular output. For attending a course of physiotherapy, we might have improved mobility or improved strength. One of my colleagues on another project is currently working on a project that looks at dance and how dance might prevent people from having a future fall, for example. And then we've got kind of some of the stuff that we've also talked about earlier, the stuff about joining a friendship group and people telling you and reporting that they're less lonely as a result of being in that friendship group. And as I've said, the difference between outcomes and evaluations will highlight how outcomes and impact evaluations will highlight later on, but it's different because impact looks at the longer term, higher level sort of difference that's made. So we've got a kind of focus on this slide of what we do and what changes, but sometimes we might want to think a little bit more in detail about the actual process. And a process evaluation sort of tells us to think about how something is delivered and collect the learning from that process that happens. And there are just a few examples of some of these how questions. So, for instance, we might also be interested in outcomes, but we also want to know how things have developed. Is it done as originally intended? How have systems and resources been allocated or used to support the outcome? And how does context influence the project? We heard earlier from several people about the different contexts of your council. So some people had, for example, quite affluent council areas, but how does the context influence the project, and that can include people as well as place and resource. And also, what are the mechanisms or activities? What's shaping what we evaluate? What does shape the actual thing that we're trying to evaluate, but also the way in which we evaluate it, also the way in which we ask these questions, and how are outcomes supported? As I mentioned earlier, we can report that outcomes have been produced, but actually there may be other factors that are involved in helping that outcome to be produced that we wouldn't get in a pure outcomes evaluation. And then finally, how is a project working well or not well? What needs to change, or what would our experience say needs to stay the same? And I've included a quote on the right of the screen. We did some work in developing a toolkit for helping people who wanted to research in rural and coastal communities. And as you can see, this is a quote from an NHS manager, and it sort of says, we've just done a dissemination event on a study we ran about strength and balance in early dementia. And again, people got physio assessments, OT, occupational therapy assessments, series of visits from rehab support workers to participate in the programme for many months. So regardless of the outcome of the research, the feedback we've got from our participants and carers that took part is that it was a hugely positive experience for them, full stop. And what we hope to do, this is kind of quite a messy quote in some ways, but that's kind of real world evaluation. So the process evaluation helps us to get at some of that messiness and some of that learning that we can extract from that experience. And then I think I'm passing on to you now, Mark, aren't I?
Thank you, Hayden. So although there are a lot of, so there's a lot of different terms here: inputs, outputs, outcomes, impact. And if you're not particularly interested in evaluation, you might conflate all of those things together as the effects of an intervention. And that's fine too. Because ultimately what regular people are interested in is this intervention good, and does it do something that it was intended to do? However, if you want to understand how an intervention works and then also present the evidence that supports your understanding of how that's worked and what's happened, then it's important to think about these terms at least at a planning stage. So as Hayden said, outputs and outcomes are commonly conflated. So for example, Graham, you talked about a program where you'd like to have more people. You said you'd like to get more people into it. So if we just measured, do people attend this service and do they like it? What we are doing there potentially is looking at outputs. So the attendance, the number of people, for example, who've attended. But if you'd want to look at outcomes, you need to look then at what are the things that have changed as a result of attending. And so that's the outputs. But in Graham's description, he also said, we'd like to get other types of people along because we seem to get the same people who organise it and the same people who come. So if the goal of your intervention, I know I use intervention just because it's a word I use, but it's project or, cafe or whatever you want to call it. If the goal of that is to widen the participation, then that's a very different outcome. And so you can measure who attends, but you also then need to measure who's attending for the first time. Are they different from the ones who regularly attend, etc.? So in terms of what is my project or intervention seeking to do, and then how do I demonstrate that it's doing that, that's why we sort of separate out these things called outputs and outcomes. And we see a lot of services or interventions that are provided And the only measure of success is how many people came. But it's the intervention is not about getting people to come. It's about having some sort of effect on their health and well-being. Now, that coming to the cafe might be an influence on their well-being, because they're walking, they're then interacting with people, but just measuring the numbers is a very limited sort of measure of success. And in today's very fiscally, financially constrained world, we all have to demonstrate that the things that we invest in are having a meaningful effect. So that's why it's important to think about outputs. What does the activity result in? And then outcomes. How does it change for the better, or, as Hayden said, for the worse, if our interventions in fact might be damaging? That's an outcome. And then the last link in the chain here is impact. And the way to separate impact from outcomes is impact is a broader, longer term effect of the intervention, whereas the outcomes are closer towards, closer to where we are in time. So you can actually measure all of these things if you set up an evaluation process that's well thought through. So how many people came through the door? How many people then reported that they felt less lonely, or that their social networks had increased, or other measures of loneliness? And then well, maybe not much later, but later on, does this affect the greater social cohesion of the community, or a sense that we are part of a community rather than an isolated person? So the impact is also something to think about. And commonly when interventions are put in place, what we're thinking about is the impact. We need to create more of a community sense, because we know that's a good thing and that makes people healthy. But what we tend to do is to measure back at the outputs, rather than actually what we wanted to do was to create a more cohesive, friendly community that support one another and make people feel that they're part of this group. That's the impact, and that's what we sort of are aiming for. But we tend to measure back at the output stage, how many people came along. And so you miss that impact, which is the really valuable thing, which is worth a lot. And if you're trying to sell this investment to taxpayers or residents or funders, that impact is really powerful. So that's why we sort of separate them out and think of them at different levels. The other thing is we learned that some of the interventions, for example, we'll look at an example of a warm spaces later on. There were some warm spaces that were created in community settings and nobody came along. Nobody attended. And so if you were just looking at the outputs, who came or how many people came, you would say, actually, warm places were a failure. But if you measure, the process, as Hayden said, why didn't people come? Was it, and someone said there's something about the setting. I think it was Robin said, we've got this great program, but the setting isn't fantastic, and we would like to be able to get the church equipped so that it can better support those activities. So that's a process sort of factor that impacts an output measurement, but not because a warm space is not a good idea, because perhaps the place wasn't accessible, perhaps it wasn't welcoming, all sorts of reasons, or people couldn't get there because they rely on the buses and the buses didn't sync with the timings. So that's why it's important to separate out these things when we're talking about evaluation, and to say to yourself, I'm going to measure some immediate things, but I'm also really interested in that larger term impact because that's actually what we're aiming for when we think about these things. Before we move on to the next slide, the last thing to remember is that the outcomes and impacts can be shared across individuals and communities, but they might look different for different types of people or different groups of people. So someone, just looking here, I think it was was it Moira? I can't remember. Anyway, talked about the painting and said, well, you know, that's something we do because we've got a slightly more affluent community. Just because you're affluent doesn't mean your health and well-being is automatically better. So, you know, it's about who is it benefiting and how is it benefiting and why it's benefiting them. So that sort of approach might be very appropriate for the community, but if you took it to Minehead, for example, you might find that that sort of painting approach is one that doesn't sync well with the residents, and therefore the attendance wouldn't be as great, and therefore the impact of that intervention wouldn't be as significant. So that, I think Hayden called that the context, you know, so all those things are really important to think about, and being able to separate out outputs, outcomes and impacts allows us to do that. It's not rocket science, but if you can just force yourself into the discipline of doing it, you actually can, really get a very good evaluation and value for money. Next slide, please, Hayden. I know I'm talking too much. So the other thing that's we've found in our work is really important is not just having leaders like us on the call who put together interventions and then drive them forward, but it's also important to involve, and I know as those people who are counsellors and clerks, this is your job to involve the public and get public's view about what it is that needs to happen. But in the health sector, patient and public involvement is mandatory. We as health researchers have to include public and patient involvement in the design of our research and the design of our interventions and the design of services. And a lot of people look at that mandatory requirement and say, oh my God, this is hard work. And it's going to take extra time. If we get patients involved, and, you know, it'll take twice as long to develop the intervention. But what we've found is that by doing that, we really get a very good sense of what does this intervention need to look like in order to be successful? What would make people engage in this intervention most? And some of the stuff that patients and public tell us is really we would never have thought of, but it's essential to the success of our work. And so it can be very useful to actually say, this is what we're thinking of doing. Can you see any problems, or what's the good things about this that we could enhance? Would you use this before the introduction of the intervention? And that can actually head off a lot of problems that we find down the track when we say, well, no one's turning up, but we've invested all this money in heating up this space and no one's here. You know, what's going on? If we'd sort of spoken with the public or the users of the service and said, is this something that would work for you? They might say, well, actually the bus service doesn't work for us. So let's change the times, or, you know, let's put it in a slightly different place. But also collaborating with people, you know, as politicians and people who support politicians, involving people is really important because it makes projects successful or not successful. But there is a problem sometimes because it's the same people who tend to participate, when really what we want is the insight of the people who don't participate, because that's the hard nut to crack. And we've found that involving the public and patients in our discussions about things at every single stage of the piece of work we do, so giving responsibility to the public to help us implement the intervention and then also evaluate it, is something that's a little bit risky. And for us as researchers, we like to control things. It's risky to sort of give that over to people, but our experience has been that it's really positive, and that our interventions are more likely to be effective and cost effective if we do it that way. So some of the work we've done has actually involved people who have experience with a particular thing. So the mental health and the men's space that one of our speakers talked about, involving people who have mental health issues seems to me a no-brainer in terms of developing an intervention for them. But it's surprising how often they are left out of the planning of evaluations or interventions. We're getting a little bit better at it, but I would encourage, that get that on board, and that half of the work is done for you. Next slide, please. I wanted to just share an example of the differences between those level of evaluations and why it's important. So there was an intervention which was conducted to increase activity or movement of people who were deemed to be at risk of poor health outcomes because of a lack of activity. And this was a study which incentivized the participants by providing rewards for the amount of activity or movement that they did over each day for the period of the intervention. And the way they measured activity was through an app on their mobile phone, a little bit like the steps, that steps app you can get that tells you how many steps you've done in a day. And so there were targets set, and individuals submitted the data from their app that demonstrated that they had met their targets and therefore were eligible for the reward from the program. That all seems very straightforward and simple, and people were rewarded for the participation. The problem was that there were some participants who subverted the data collection by giving their phone to their children, or there were also devices which were created or on the market where you can place your phone and it rocks the phone backwards and forwards to give the phone the sense that you're moving. And so there are a number of participants who were seemingly meeting their goals because the measure, which was the activity, had been completed, but the actual activity had not been. Now, the process evaluation would pick that up, but if you're planning an intervention which is to get people moving and active, but the actual outcome is an improved health outcome, so maybe it's weight loss, maybe it's better cardiometabolic health, maybe it's something else, you can see that the intervention itself, as measured by the telephone's movement over time, does not lead naturally to the outcome that was expected. And what the participants also were incentivized to do was to get the prize. And in some cases, it was get the prize without actually doing what they were supposed to do to get the prize. But because the prize became the outcome, or the measure that was important or valued by both the participants and the researchers, it possibly didn't have as much impact in terms of health outcomes as we would expect it to. So it's important that there's also a measure of health outcomes as well as the actual activity, because one is linked to the other. And if you only measure one, you're not certain that the second one is also going to be achieved. So that's just a real life example. What we're going to do now is look at an intervention which is one that you'll all be familiar with around warm spaces. And we've got two warm spaces from Somerset on the screen now. One is the Water Row, am I saying that right? Village Hall in Chipstable Parish, and on the left. And the other one is the Minehead Eye Cafe Skate Park. And both of these were locations for warm hubs. in Somerset. So the scenario we're going to talk about now is this one, and I'm going to read it. So apologies for having to listen to my voice a bit longer. With winter coming, a parish council has been given funding from Community Health and Wellbeing to develop a warm hub in their community. In the short term, the project aims to attract local residents to visit and use the building as a warm space. The grant includes a modest budget to develop activities, services and signposting so that they act as a hub, in addition to providing the warm, the nice, cosy, warm space. It is hoped that the project will have health and wellbeing benefits resulting from reducing loneliness, alleviating fuel poverty, and developing social relationships. As a key part of the project is to test one hub with the idea of then rolling it out across the town. So the evaluation is quite important in terms of this intention to maybe scale up this intervention. So the council now has to plan for the evaluation of this project. So what we'd like you to do is to just imagine that you are a member of the council's committee who are responsible for this project. Thanks, Peter. And you need to give insight and support to your council committee on evaluation. So as part of the evaluation team who are going to actually monitor the project and then determine what the outcomes are so that your council can then make a decision about whether to scale this up into a larger network of warm hubs. So a familiar scenario for a lot of you. So what we'd like to do is to have a discussion around that scenario. Think about the things that we've already talked about in part one of today's session, the different types of evaluation and how we might approach it. Think about the questions that Hayden's going to take us through, and also identify ways in which what would be a useful evaluation of the warm hubs. And we use that term useful in a meaningful way. So what would add most value or be most helpful to you as the committee member? And also thinking about who are the people who are going to benefit from this intervention. And the important thing to think about there is not just who's going to benefit, but who might not benefit or might be excluded from being able to access the benefit of that intervention. Is that okay?
Yeah.
Yep. Great. Thanks, Hayden.
Okay. So yeah, in order of symmetry with part one, I'll probably lead in on the outcome evaluation section of this part. So if we just recap, remembering that the outcome is often a short to medium term result. Thinking about the warm hubs, can anyone on the call firstly suggest what might be some of the intended outcomes of the project, please? And I'll just stop sharing my screen while we do that. Would anybody like to have a go?
Less loneliness, people getting together, feeling warmer, feeling comfortable, talking to other members of their parish council, parish members, just contacting other people, feeling physically warmer and mentally warmer. So getting themselves talking to other people rather than sitting on their own in a house. Maybe they're with other people, but maybe they're just not talking. Maybe include things like some board games or something like that.
Thank you. I think Anne had a hand up, a physical hand.
Yeah.
Yes, well, the things that you wanted in the first place was more community cohesion, so less loneliness. So that would be the outcome that you would be looking for.
Yeah.
Which one, Anne? Cohesiveness or less loneliness?
Well, I think they're tied.
Yeah.
social
See, this is why it's
cohesion.
hard, isn't it?
Yeah, social cohesion and more connectedness in society. I think that is less loneliness.
Right. So I think in the short term, remember that the outcome is a the short-term result that we want to monitor. So the activity, and we heard from the previous person, I think it was probably Jasmine. The activity. There was some activities included there, but there were also some outcomes. So some of the outputs, the activities, are actually the people who come to the group to keep warm. So that's the number of people keeping warm. And then the outcome is arguably people becoming or reporting less lonely in the short term. Now, in the longer term, the bigger impact is actually the relationships that people develop and the sense of community. So in some ways, Anne, you're right. It all can get quite muddied, and at the end of the presentation, we'll present a way in which we can kind of plan out a project that will hopefully help with some of these distinctions. Has anybody else got any other?
Sorry, Hayden. Before we go, can I just say, Anne Hills, Hayden used the term muddying the waters in a positive way, because you're absolutely spot on. All these things are connected, which makes sense. This is what we're trying to achieve. So part of the task is, okay, how do we untangle that and say, this might be a good measurement of loneliness, and then this might be a good measure of cohesiveness of the community. And we're expecting that those two things are related to one another. And if we show that, then we're more confident that the intervention, which was the warm space, has actually led to cohesiveness. So it wasn't someone coming to the warm space, then finding out that there was a craft club, and going to the craft club, which then lead to the cohesiveness. So it wasn't the loneliness per se, it was just social activity. And also the other thing that we've come across is loneliness is sometimes conflated as isolation, so no social contacts. But we know that people can have a limited number of social contacts but not be lonely, because the social contacts they choose to have are really high value. So I don't want to get too confusing, but I just wanted to point out, Anne, that that's the good thing about the way you presented that, but it's also then that's the challenge of how do we measure it. Yeah.
I think, Pauline, you raised your hand a moment ago. Your virtual.
I think for me, it's the problem of how we measure things and what we're measuring.
Yeah.
So you could do things like, as you say, who attended, how many of them, where have they come from? Are they local? What are they, local people? But there are also reasons for people's attending, which is more qualitative, I suppose, and that's harder to sort of get at. Is it because of the activity? Is it because they want to save money by not using power and stuff at home or whatever? But then also look at those who aren't coming. And as I think we discussed earlier on, isn't it? Is it the venue? Is it the day or the time? Is it because they don't feel very sort of fit in? An example, there's a friend of mine, her elderly aunt, there's a local sort of dinner club one day a week with his community centre. So we suggested to her elderly aunt that she goes along to this, and she went, no, she said they're all really old people. This is from somebody who was he was 91 at the time. So the reasons why people aren't coming as well, it's and for me, I think it's the outcomes sort of how you separate those out. And I know there's some very clear examples earlier on, but when you actually try to apply it, that's when I think, is that an outcome or is that an output? Or so does it actually matter? I suppose, is it in the long term it matters, but in the short term,
I think they can matter for a variety of reasons. So remember, and I think some of the questions that you've asked are those how questions and why questions that we would have in a process evaluation. So you may know in your local area, you may have some stuff from your local data observatory that tells you that this is your population, this is the age groups, but you know that some of those people aren't coming to that particular warm hub or group. And why is that? And then you would probably go and ask those how and why questions. Why are you not interested? But in terms of outcomes, that would be the process evaluation telling us about how outcomes are achieved or aren't achieved.
And Pauline, I think also, there are people that have got loads of money and they don't need to go to a warm space to get warm, because they've got, they've cranked up the central heating to max and they're quite okay, thank you very much. But that doesn't mean they're not lonely. And so it's interesting how the warm hubs example has moved from keeping people from freezing to death to loneliness, this loneliness thing. So what is the intention of the warm hub? So if we go back even further, what is it we're trying to do here? Or originally we were trying to do, but it appears that perhaps there were unintended positive consequences of the warm space crisis that we're now linking with loneliness reduction. So that's really interesting too. I've stopped.
Yeah. Sorry, Emily, would you like to?
Hello. Yeah, I'm sorry. There's a chainsaw in the background, so I hope you can hear me. There's always something. Yeah, I was thinking about the example, and you said that signposting was one of the things that the Warm Hub also intended to do. So I'm guessing that the signposting, in terms of the numbers of people signposted, is an output, and then the outcomes might be around people feel more knowledgeable about the services that are available to them, and they may be confident in approaching this. Does that sound right?
Yeah, that's brilliant.
Yeah,
brilliant.
Yeah.
And you could even go a step further and say, does that knowledge and confidence mean that they then contact that service successfully? Now, none of us have got all the money to do all the huge evaluations of every single part of the chain, but if you can do a number of parts like that, you can actually be more confident that it was actually that first thing that started that chain of events which led to that. So I think that's a really good example. Yeah.
And it's also being able to demonstrate that, so that what we talked about the potential rollout of this project. So some of it is about demonstrating that case for this particular project, and we would probably call this a kind of a pilot or an exploratory study, and then it would roll out the network. Bodo, did you want to?
I was only going to say that we often, when we think about warm spaces, we often think about one demographic, which might be older people and possibly people on low incomes, and we have to think about younger people as well, particularly people who are at home with young children. And so it's as much about the activities you put on in order to get people through the door, rather than calling it a warm space. Having different activities might actually be part of how you measure your all factors in relation to it, but certainly your inputs and your outputs.
Call it a hotspot maybe, but that's what Pauline was saying about her mate who said, I'm not going there because it's just for old people. That's a sort of exclusion. But if it's old people that the service is set up to support, then that's appropriate. But if it's all people who are experiencing loneliness and cold and what have you, then you can see that service is only reaching a part of the population, but not all of it. So yeah, it's going to have it.
Yeah, I was just going to follow on from what Fodo had said. and you know, those two images that you put up, I can't imagine an elderly person going to a skate park to experience a warm space. Similarly, you're not going to attract young skaters to the village hall necessarily. So your choice of your pilot is going to impact your data. So
Context.
yeah, absolutely. So you know, one of our most successful warm spaces, I can't remember whether it was last winter or the winter before, was the Good Heart in Frome, and that was for people with toddlers after they'd taken their older child to school, then having a tiny heart session in the Good Heart after that, and they were young mothers, and mainly mothers, but young mothers of tiny children, and having a space where they could interact as adults while their children played was so important. So I think different people would use the warm space at different times of the day. So you need to look at the activities that you put on and whether they're appropriate at that time of day, or whether it's a Sunday and the weekends. And so having information not only about numbers of people, but who those people are and when they attended and what sort of activities attracted them at different times of the day. Sorry, long ramble.
No, I thought that was really important, and I think it links to the next bit. I won't reshare the slide because it links quite nicely. So we've talked about a lot of the so we talked about the activities and then some of the outcomes. Can you think of how we might be able to sort of demonstrate that these outcomes, so feeling less lonely, what sort of approaches could we take at finding out that this outcome has been achieved? Could anybody give us a few examples, perhaps? Yeah, and
well, just what they tell you. I mean, it's not very easy to measure how lonely you were before and how less lonely you are now. But if people report the fact that they feel more connected, feel less isolated, feel less lonely, then that is data. It's anecdotal data, but it is data.
Well, I'll go to Photo in just 1 second, but I think there is something quite important there about how we value different sorts of data. And I would argue that what you could actually do is interview the people who go and ask them before and after whether they feel lonely. But there are also scales that you can use out there if you wanted to kind of talk to a wider audience. There are certain short scales that we could use and ask people to participate in before and after. From my own experience, it's always much easier to implement these scales and these conversations as a natural part of the service rather than something that's put in retrospectively. In some of the projects I've worked in, a lot of people then want to know why they're asking all these questions now and etc. And they get asked about everything from whether they bought a soap dish on Amazon and how nice it was, and you know, they're evaluated to death. But I think if we put this in a context of a service delivery, then that can be really useful. Fodo, would you like to join?
I think if you're running sessions, you can actually also just gauge it from whether people come back, whether people have smiles on their faces, whether people start actually coming into a room and chatting to people and maybe even helping set up the space, what time they turn up, those kind of things. I run Singing for the Brain in Taunton, and what's really noticeable is the people with dementia don't have to come with a carer. Quite often they do, but when the carers are choosing to come with their loved ones because they see the joy in the person with dementia's face, and how much they're getting from a singing session, that is a measure. You know, you can measure it as much, you can measure it on those intangible sort of things, if you like, by different conversations that aren't. I mean, I used to do work for Somerset Skills and Learning, and we always used those hacked surveys. And whilst they're great, that question, how did you feel beforehand, and it was a scale of 1 to 5 and a low, maybe about a dozen criteria, and then at the end of a 10-week session or whatever, they get it back again and say, how do you feel now? They filled those in because they knew the project was funded, and they didn't necessarily fill them in because that was the answer they really would have given. And sometimes I think measuring those sort of smiles on people's faces and do they come back, though, are as valuable. Are they talking to somebody at the end of the session and they don't want to go home? Does that make sense?
It does, Photo. And before we come to Moira, just to comment on that, this is the discussion around what are the outcomes that are valued, and what value do we place on those things? If it's just about, you know, we struggle all the time Hayden doesn't like to call himself a scientist, but we struggle in terms of evaluations and having so-called objective measures where we have to quantify or give a number to something, and then we have to put it into the statistics package and get some fancy thing out the other end. And it's only that, you know, funders or people will pay attention to. But actually that is missing all of the added value that you just talked about, Photo. And sometimes, yes, it can be a small scale that's useful, but sometimes it's just about what was the best thing about coming to this service? Open question, not about loneliness, not about this, but, you know, I've made friends for the first time in 20 years. That is priceless. That is absolutely priceless. Why did you keep coming back? Because you come 4 times now. What made you come back? It was the brilliant, you know, whatever it was. They're sorts of ways you can measure valued outcomes. So we shouldn't shy away from that. But equally, we shouldn't go to this atomistic measurement by numbers of everything as the only way to measure, because this is social stuff. This is not, you know, it's not pharmaceuticals or anything like that. Moira, and then we'll come to Anne Hills, who's using a physical hand again, which is fine. Moira.
Oh, hi. Yes, I agree with the previous lady. I think it is the host that can do the interviewing, that can go around and see if people are enjoying themselves, if they're going to come back, and why they're going to come back. And not everybody is going to go to a warm hub to actually keep warm. They're going to go as a host to make the coffee, bake the cakes, or whatever, you know, is happening at the time. And I think eventually these warm hubs may turn into cool hubs if we get hot summers. Fingers crossed.
Yeah, absolutely.
And I think it can appeal to all ages. I mean, if you look at a big scale, like Glastonbury, for instance, they have warm hubs if the weather's bad, and they have cool hubs if it's really hot. And it's not just older people that go there, it's everybody who goes there, from tiny tots to teenagers, absolutely across the board.
Mm. And I think that links quite nicely that, Mark, I'm reluctantly, sorry, Anne, we will get to you. I don't want your arm to start aching or anything. But the reason why I'm a little bit uncomfortable with the word scientist is that I'm not somebody who wears a white coat and goes into situations and tries to tick boxes and measure things. And I think what you pointed to there, Moira, is really interesting. And I think it even links with Mark's session a little bit later about participatory approaches and how we can engage with people effectively. But I'm going to go to Anne now because I know she's been waiting a while.
I know it's just reinforcing what everybody else has said. And if we think back to one of the reasons why we need to evaluate projects is for funding applications. And what I'm on both sides of the fence, because I dole out funds as part of the grants committee on Town Council, but I also, in other organisations, I do sit back if it's one of my grant applications. But what brings a grant application alive is the stories. So you can have facts and figures, but you in your sidebar you have, and here's a quote of someone who used our service, and this is how it changed their life, and that's what makes a grant application a great grant application, and it's more likely to be funded.
And I think that doesn't necessarily have to be anecdotal. There are methods that researchers use and that most people can use, such as interviews and case study vignettes, for example, that really demonstrate that value as well. So I think we've talked about some of the challenges about also trying to kind of get at outcomes in our discussion. The next one, and I'll try and reshare my screen again, because the next discussion we've sort of touched upon when we mentioned things about context. Sorry. So I'll just see if it'll present again.
Go back to the beginning.
So yeah. So yeah, the next one is when we talked about process evaluations, and I think we've picked upon some of those now questions, but that if we remember about the earlier slide on process evaluation, we included things such as context, and I think Mark picked up nicely on some of those contexts in which you deliver a warm hub service, and I particularly now like the idea of perhaps a 91-year-old person going to a skate park, which is probably says more about me than anybody else. But so if we can take that warm hub scenario again, what sort of questions, and I think we've asked a few of these, but what sort of questions would you think a process evaluation would involve? Philip, yes.
Yeah, I think sort of taking a step back as part of a committee looking at a project, the first thing should be looking at the context within which the project would run, and that would, for me, sort of look at the local environment and is there something similar already? What is running already in the area that is addressing the needs of your community, and is there an overlap with what you're intending to do or not? There's finding something similar to what you're doing, which may or may not be in your community, and actually going and having a conversation with them and getting all of the learning from that project, so you're not reinventing a wheel, and see which bits of that project fit with what it is that you're trying to achieve. But I think also there's identifying the wider network of support that is available to your community that may or may not be being accessed. And this goes back to the scenario of referrals, and how your project can engage with those other activities in terms of the signposting, but also using those activities to bring in different segments of the community to benefit from your activity. So that might, for example, be establishing a carers group. It might be bringing in the village agent to do a talk, or open mental health network, or whatever it might be, so that you're engaging with different people in the community. So I think that the first stage in designing this project is that more holistic, wider view of what's already happening, and then seeing where your activity fits and the process that will leverage the greatest value to your community, and the gaps that aren't being filled, the need that isn't being fulfilled in your community. Does that make sense?
Yeah, that I think there we've got quite a bit of the nub of context, haven't we? So how does context affect what we're hoping to do with a particular intervention or project? But I wrote down a few other things as well as that. But also some of the context is how can we bring in other people? So we start asking these questions. How is this project being run elsewhere? What is the context of the sort of knowledge base of other projects? And sometimes, and Mark, this is not a scientist speaking, but in community development, we'd just do some approximate scoping, wouldn't we? We'd see what's going on in the area and see if we can get a picture of the services that are run in that area, as you suggested. Would anybody else like to just have a go at some of the process? Moira?
Yes, I think transport is a big issue. I mean, let's assuming you're a wheelchair user and you're very motivated, so you can get on the bus, so you can get there. What if you're a wheelchair user and you're not very motivated? You need somebody who can take you. So there needs to be provision in the area for people who are willing to transport others to venues.
So I think, again, more context. So in that respect, you would probably be asking questions: how are people accessing the service? Who's accessing the service?
Yeah.
And those sorts of questions.
It's also, Hayden and Moira, it's also about assumptions, isn't it? So what do we, so our previous speaker was talking about finding out from other projects that are similar what happened and where the gaps are, like that, where the gaps are, who didn't come, because it's about the assumptions that we have prior to the intervention. So we have an assumption that people will be able to get there. One, so put those assumptions down on a piece of paper. What are we assuming here? And then, they're the things, Moira, that we look for, particularly in process, where we say, well, actually, we're not getting anyone from this particular part of the community. We're assuming that they all have equal access, but we're not getting equal participation. So have we made an assumption that's, causing problems there? So they're really, those assumptions are really good for the process evaluation to say, okay, we've made these assumptions, we had to, because we can't possibly consider every single thing. But what we'll do carefully in the evaluation is monitor who's coming and who isn't coming, and are there particular assumptions that we've made that perhaps we should have, paid more attention to. So I think that's really where that process is about. It's watching the program as it plays out, and then seeing what is not happening, and then looking back to our assumptions and identifying, that we've done that.
So Emily, would you like to jump in?
Emily, Pauline, and then Anne's got a hand up too. Yeah.
Hello. Yeah, I was thinking about thinking from a based approach in terms of the process stuff. I would say, and thinking about context, I would say about the effects on the people that are actually running the hub or whatever project it is. So whether those people, presumably hopefully you've got people in there that are pretty good communicators, but it might well be that it's useful to measure like the impacts on those people as well, because they're part of that sort of scenario, and it could well be that they kind of gain skills and benefits as a result of sort of whether they're volunteering or working or whatever. I just think they're part of the picture, so it's worth thinking about the effects on them as well.
So I'm happy for you to join in, Mark. But I think there's a question there about how do people benefit and from this particular intervention, and I think some of that depends on where your scope is. So in a process evaluation, you would probably ask the question, how or who else benefited from this project, if we were looking at kind of the users as our primary focus. But there's nothing to say that you couldn't do a project where the people who run the Warm Hub are actually the people who are in scope, and that's where your focus is.
And they're critical to the success of the Warm Hub. So meeting their needs is important too, isn't it? Just to come back again to Philip's, because Philip's point was so penetrating and so useful. This is the process, again, is really important, because if you take an intervention, Philip, as you said, from another place, plonk it down in your place, and then you measure it in exactly the, so you assume that it works. What you're doing, Philip, is assuming, okay, this intervention did this over here, so if we put it here, it will do exactly the same thing. And then we measure in the same way, some sort of thing, and then we go, oh, well, it didn't actually work. What happened? You know what I mean? And it's that context. So it's about, you know, being careful not to take interventions holus bolus from another place, plonk them down, and then expect they're going to roll out the same way. Because what will happen is the funders will say, oh, Philip, this was a good, good on you, mate. This was good. You did a good job here, but the intervention doesn't work. So we're not going to fund it going forward. But if you've carefully gone through and said, there are assumptions and different contextual things here that we need to keep an eye on as we evaluate this intervention in this form, that can then say, well, it didn't work in exactly the same way or with exactly the same effect as it did over there, but that's because this, that, and the other happened. It's still valuable and it's still useful. But what we need to do through our process evaluation and reflection is say, we need to tweak these parts of the evaluation to make it fit our context. That's why I think the process is really important to monitor, not just I put an intervention here and then I measure it using this tool at the end that they used over there. Because what that does is leads to the false assumption that something didn't work, it's not effective. Whereas in fact, it's not producing the same effect because it requires a different set of conditions. You see, so that's important. Sorry, I'm jumping in again, but I think, so valuable.
Shall we go to Pauline first, because she's been waiting a while, and then go to Anne and
Soto.
Yeah, just very quickly, and it sort of draws together some of the last few points as well about assumptions and context and stuff, is getting people involved, so getting participation involved at the sort of the design stage. So there may be good reasons why an approach from elsewhere, for example, might not work here, and you know, so getting some of the potential users involved, getting their opinions about what might and might not work. So yeah, that was it really. So
yeah. I think Anne, was it Anne next?
Thank you. Yeah. So I'm going back to part of the process evaluation is who's using it and at what time of day they're using it, because it may well be that, you know, in your pilot you've got it open from 9 until 9, but nobody's there after 7 o'clock at night. So you know that when you roll it out to other hubs, well, there's no point in us funding it to be open after 7 o'clock at night because nobody came, and the people came. There was a peak in demand at this time of day, so this is when we need extra people, extra volunteers or whatever, staffing the hub, because this is when people want to use it. Or, you know, the young mums use it on their way back from the school run, but the more elderly people used it at 3 o'clock in the afternoon, and everybody had left by 7 o'clock. So it's more granular than how many people used it and who used it. It's when did different people use it?
How did they use? Yeah, absolutely.
Vodo?
This might have been sort of covered in your ideas, the discussion around you can't necessarily pick a project up and put it in a different place, which is very true of a locality, a venue, or just your demographic of your people, and how a certain area might be have a different community feel to another place. But has anyone touched on the fact that whoever is leading a group is really important? And you might have an amazing project and you have a different person take that project even on in exactly the same scenario and the project falls apart. Because there is something about, and I know this, we all know our favourite teachers from school.
Yeah.
And so we have to evaluate as well how that delivery was delivered, how it was delivered by in a certain way with a certain, I don't know, something that just fit that moment. And that isn't even necessarily that you can pick up that kind of leader, facilitator, let's call them a facilitator, and take that facilitator to another place, because again, that doesn't necessarily fit. It's about finding the match, isn't it, between understanding your community and what they might need, and if they need a really buoyant approach from a facilitator, a very lively thing to bring them in, or if actually it needs to be very calm, if it's better therefore done through maybe church groups and it's very gentle, or it might be something like, I don't know, I'm just saying, but I think the facilitator and how that matches everything else, you need to evaluate as well.
Yes, that's the £64 million question, Photo, because as scientists, sorry, Hayden, as scientists, what we try to do is remove that influence, because you can't bottle that and say this is, but what we need to do as social scientists is say that role is really important, as an important part of the package. Without that role, the package doesn't work in the way that it's worked here. And when we go to funders or, central government and say, this intervention is really effective, they go, awesome, we'll do that. But they've lost that, it only worked like this because it had this. So, and it's difficult to put that into a bottle and say, if you get some of this in with this intervention, then that will happen. And so that's why we need more creative measures of evaluation and paying attention to those things that influence the success. And again, that's where process is really good for doing that. So absolutely.
Can I just come back on that really quickly, because I've been running community music projects for many, many, many years, and I've stopped doing that because I'm doing this job now. But one of the things that I've been asked is, how could I train other people to do that? And in some ways I could train other people to do that, but it's that $1 million, do they have it? Do they react really well with adults with learning difficulties? Because if you don't, if you're not comfortable, you're never going to learn it. But I'm thinking off the top of my head, which is because I know there's people in here who are potentially looking at grant funding, maybe that is something that someone could apply for our fund to actually roll out. Is there something there that we try and do that evaluation and have people train each other as a facilitator session, what works, what doesn't work? So that's just completely throwing that out there to all of you who might be looking to health and wellbeing grant from SALC.
Yeah, that's great, Photo. And I'd be interested to hear Frederick, as a public health specialist, about the influence of champions or individuals. But this idea of train the trainer, or having apprentices that move up through a service and work with that person and then be able to take on some of those other qualities, that could be models as well. But I'm conscious that we're losing track of our time, which is great, because I think all the conversation's been really super valuable. Do you want to look at the theory of change, or maybe leave it for the next time? What do you reckon?
Yeah, well, do you think we've covered impact?
I do. I think these folk know more than I do about impact. It's just about giving it the names, isn't it? Yeah, well, we could probably run another kind of moment of discussion on this point, but sometimes it's kind of hard, as we've discussed today, to kind of separate those important things out. And we'll send the slide decks round, so you'll have a bit more of
time to look at this, and my email address is on the slide deck, so please feel free to get in contact. But we can see on the left-hand side those stages that we've tried to tease out today. So the context or problem and reason for a change, then inputs, resource, activities, outputs, and then outcomes, and then at the top we've got the long-term impact. But I think thanks, Graham. As Graham's indicated, I think we're running a little bit out of time, and we might want to give a little bit more to kind of discuss this, because I've also prepared a separate diagram that shows us some of the methods and approaches we can use at each stage in the process. Fodo, I'll let you just...
I was just going to say as a follow-up, I mean, it's probably for Frederick to say, but this is potentially the first of these evaluation sessions.
Yes.
So there is the scope, everyone, for the Lincoln team to possibly even come down and do some face-to-face work for a longer session, if that would be something that people feel would be beneficial. Not quite sure where that would be, but also for more online sessions. This is a really valuable kind of area for us all to be aware of as we sit and hand a grant. I'm a town councillor as well, along with Pauline at Wiveliscombe, and when we hand out grants, we don't even ask for any feedback half the time, or if we do, it doesn't come to us. So this is a really good process both ways round, as grant givers, as people who might be in receipt of grants, and also because we as towns need to step up our delivery of all sorts of things. Somerset Council are going to drop a ton on us, so we need to be really aware. I mean, I don't know if the Lincoln team are aware of how precarious the Somerset Council situation is, but we don't know what will be dropped on us, and we need to be really looking after our communities. So do stay in touch and make sure that we know if you're interested in follow-up sessions.
Maybe
maybe
that if you get in contact with me later, we could actually use one of your examples for one of those sessions. So we're actually using a real proposal.
Because I know Anne Hills, I'd be terrified if you were assessing my applications. But this is a way of this is empowering, isn't it? And I don't say that in a condescending way, but if we know how to do these things effectively, then we're more likely to get a successful program, and we're developing ourselves actually as individual skills. But these are the things that increasingly down the local authorities are becoming more of a responsibility for us, particularly in the cases of Somerset with this unified sort of movement going on and all sorts of things. So it's really important that we're all empowered as leaders to be able to use these tools effectively. So we can unpack any of these parts and go through more detailed impact or outcomes or participation or whatever it is. We're very happy, and I know we've had a long relationship with Frederick and his team at the Public Health, so we're aware of the context, and Frederick's also aware of the skills that we potentially have that we can offer to this process. But I have found personally this conversation today really stimulating. This is the good part of my job, is doing stuff like this. So if you see value in it, we're very keen to continue the conversation. I see Frederick's got his hand up.
Yeah, thank you. Just to build on what Fodo said, and Mark and Aidan as well, this is absolutely just the beginning of a potential series of sessions that we could present, but applying a very participatory process. We would really value you to feedback to us, not only on today's session, but topics you would like to see in the future. And as Anne mentioned, Fodo mentioned, we could, for example, have face-to-face sessions if that will be of more value, developing tools together, but really let us know of today, future sessions, what would really help you to, again, and benefit the community's well-being and health. And I know Hayden will speak about a link for the evaluation form at the end. If you could fill that in, we will look at that and really respond to that as much as we can. But again, thank you for a really good first session, really, really valuable stuff. And I think it's just a start of wonderful dialogues and working together moving forwards. Thank you so much.
Thanks, Fred.
Thank you. So yeah, I'll probably send these slides round if that's okay, Fodo, if you could make contact, and then my email's at the end there, so I'm happy to respond to people either one-to-one emails, or maybe we set up an informal group discussion going ahead. And also, yes, there is a link. Unfortunately, I've not got it on the slides, Frederick, but we can send that link with the slides, and it'd be really great to get your feedback and see what other kind of things you'd like to gain from the next sessions. We've also included some follow-up resources, which unfortunately aren't as pretty as the slides, but they do have some links to some things that you might find interesting, as well as some government questions that relate to those particular stages of evaluation. But no, thank you everyone for joining us today, and hopefully we'll get to link up in the future.